Hey everyone, today I'll be talking about severe acute malnutrition. Severe acute malnutrition usually affect the children between the age group of 6 to 59 months old. In order to say that a child is suffering from severe acute malnutrition, there should be presence of any one of the four criteria. First criteria is weight for height should be below -3 standard deviation, or there should be visible severe wasting, or there should be presence of bipedal edema, or the mid-upper arm circumference should be less than 11.5 centimeters. The next question which arises is, what is the cause of severe acute malnutrition? The etiology can be divided into various headings. First, what we have are the immediate determinants, which includes a child having low birth weight, or the child is suffering from any illness. Second, what we have are the underlying determinants, which involves the food that the child eats and the basic health care that the child gets. Also, there are some basic determinants, which include the education level of the family, and also it involves the socio-economic status of the family. Now, the clinical features of severe acute malnutrition can be divided into two syndromes. First, what we have is marasmus, and second, what we have is kwashiorkor. I have briefly discussed the differences between the two. First, what we have is the appearance. In marasmus, the child has something which is known as monkey faces, and also there is baggy pants appearance. Now, what I mean by baggy pants appearance is that the loose skin of buttocks is seen hanging down. Whereas in kwashiorkor, the baby appears as a fat sugar baby. Second, what we have is wasting. Wasting is present in both marasmus and kwashiorkor. Third, what we have is edema. Edema is usually absent in marasmus and it is present in kwashiorkor. If I talk about the activity, then a child suffering from marasmus is generally active, while a child suffering from kwashiorkor is usually apathetic. Now, I would like to discuss some features of kwashiorkor in brief. If I talk about hairs, they have special appearance which is known as the flag sign. Also, what you would see is a distended abdomen. And if I talk about the skin changes, then you can see there is increased pigmentation of the skin. Such children are also likely to suffer from cardiovascular changes, and also they can suffer from anemia. So this was the overview of marasmus and kwashiorkor. If I talk about treatment of severe acute malnutrition, then You broadly need to treat the baby under the following headings. First, what you need to do is correct the hypoglycemia. Second, what you need to do is correct hypothermia. Third, what you need to do is correct the dehydration that the child is suffering from. Fourth, you need to do correction of the electrolyte imbalance. Fifth, do treat the infection if the child is suffering from. Sixth, what you need to do is correct the micronutrients deficiency. Seventh, what you need to do is initiate feedings. Next, what you need to do is go for catching growth. Then you need to go for sensory stimulation. And once everything is corrected, prepare the child for follow. So this was all about severe acute malnutrition. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video and subscribe to my channel. Thank you.